We ended the last section with this picture, and I wanted to hit it one more time again. So this is a picture of someone drinking raw eggs, and this used to be fairly popular, but what we know is that egg whites, raw egg whites, contain a protein called avidin, and the avidin protein tightly binds with biotin and prevents its absorption. So it decreases its bioavailability, so its availability for absorption in the body. And even if you weren't concerned with biotin deficiency, raw eggs should never be eaten because they can contain salmonella, and it's it's a harmful bacteria for foodborne illness. So make sure you're thoroughly cooking eggs to kill the bacteria and denature the avidin so that it can't bind with the biotin. So pantothenic acid, what are its functions? Again, it's a coenzyme needed for carbohydrate, fatty acid, and amino acid breakdown, and for the modification of proteins, as well as the synthesis of neurotransmitters, steroid hormones, and hemoglobin. And it's needed to form a molecule essential for cholesterol and fatty acid synthesis. So this talks about its how much is needed, its sources. It's abundant in meat, eggs, whole grains, beans, and lesser amounts in milk, vegetables, and fruit. And it's rarely we see a deficiency in it, so it's widely distributed. So if you get a supplement that's high in pantothenic acid, well, you really don't need it because most people don't get a deficiency in it, so you're kind of paying for nothing. Vitamin B6 functions, that's important in amino acid and protein metabolism and for the synthesis of non-essential amino acids, neurotransmitters, and hemoglobin, for the conversion of tryptophan to niacin, and for glycogen breakdown. There are three forms of B6, and they are converted into active coenzymes. And they're needed for the activity of about 100 or more enzymes in carbohydrate and protein metabolism. So B6 is particularly important. It synthesizes non-essential amino acids, if vitamin B6 deficiency can lead to poor growth, skin lesions, decreased immune function, anemia, and even neurological symptoms. And because B6, we see in this picture, it's part of the functions of myelin sheaths and in the formation of blood cells. And we know that it also helps decrease our levels of homocysteine, which reduces our risk of cardiovascular disease. Additionally, I was talking about a deficiency is poor growth, skin lesions, decreased immunity, anemia, and neurological symptoms. And we know with excesses, there's no reported effects from food, but supplements can be toxic, causing severe nerve impairment. So I know a lot of vitamins are energy supplements or B vitamin supplements. Now just remember that the supplements aren't providing you energy, they're making available the B vitamins if your diet is deficient in it. And see all of the sources: chicken, fish, pork, organ meats, whole grains, legumes, sunflower seeds, banana, broccoli, spinach, and some fortified cereals. So remember that the vitamins don't provide energy, but they are coenzymes in the process of using carbohydrates, fats, and proteins to make ATP, which is the energy, and that's what they're really referring to. So it's kind of a misnomer when they're saying that they provide you energy, because remember, vitamins don't actually provide energy. So sources of B6, a lot of chicken, pork, lentils, peanuts, walnuts, sunflower seeds, brown rice we see there. Folic acid, we're going to talk about a lot about folic acid throughout the chapters because it's very important. Folate is a coenzyme needed for DNA synthesis, so especially needed in rapidly dividing tissues and in some amino acid metabolism. So it's important in early pregnancy for neural tube formation, and it helps with brain development and spinal cord development. So if you're deficient during pregnancy, that's where we start seeing neural tube defects. It prevents our homocysteine levels from rising. So we saw that in a previous picture, and that helps to prevent heart disease. Here we can see day 19, 20, 22, 28. So very often, before people even know that they're pregnant, it's very important to have folate in their diet. So they often tell women that are planning on pregnancy. And here on the picture that you see a terrible picture of a child with spina bifida. And what that is, it's a condition in which the spinal cord forms abnormally, and many babies with spina bifida have learning disabilities and nerve damage, and it can cause varying degrees of paralysis of the lower limbs. And if the head end of the neural tube doesn't close properly, the brain doesn't form completely. This can result in different types of encephalitis, and babies with encephalitis this type are usually blind, deaf, and unconscious, and often can soon die after birth. So that is why everyone's really focused on folate. Here we see that folate is a coenzyme in healthy red blood cell production, and in the reduction of homocysteine levels, which lowers these levels and lowers our risk of cardiovascular disease. Here, it's important to know that RDA in men and women are 400 micrograms a day. We find this in rich grains, leafy greens, asparagus, beans, legumes, nuts, oranges, liver, yeast. We know deficiencies cause all of these types of anemia, spinal neural tube defects, poor growth, nerve and development problems. There could be concerns that excess will prevent folate deficiency symptoms and mask some B12 deficiencies. So remember, too much of anything is not always good. Sources: beans are a very high source. We see here spaghetti, and asparagus, spinach, orange juice is often fortified, peanuts, sunflower seeds. B12, you hear a lot about that. It's a coenzyme in ATP production for certain fatty acids, for the conversion of homocysteine to methionine, and for the maintenance of the myelin coating of the nerves, and it's involved in amino acid and protein metabolism. This diagram talks a lot about the various functions in the body, and the body can store some and reuses B12 more efficiently than it does most other water-soluble vitamins. So deficiency is usually caused by poor absorption rather than low intake alone. So absorption of adequate amounts of B12 for food depends on the presence of stomach acid, protein digesting enzymes, and intrinsic factor. So here is a graph that also shows that supplemental folic acid can provide enough active folate to prevent folate deficiency, even when it's you're not getting enough or absorbing enough. And then active folate, there's two types, active and inactive. It cannot be made if B12 is deficient, and that's where we can see some anemias. So what's the RDA? About 2.4 micrograms a day. It's found naturally only in animal products, so that's why sometimes you can see deficiencies in vegetarians unless they're very specific, and making sure that they're getting vitamin D12 from other sources. Deficiencies, we talked about pernicious anemia, increased homocysteine levels, decreased active folate, numbness and tingling, gait abnormalities, memory loss, disorientation, paralysis, and death. And there can be excesses if you take up to 100 micrograms a day, because you can see we only need 2.4, so too much of anything can be too much. And we see most of its sources are meat and dairy products. Vitamin C, everybody knows about, is ascorbic acid. That's a water-soluble vitamin. The synthesis and maintenance of collagen, so that's our skin and the base of all connective tissue in our body. And it's needed for synthesis of neurotransmitters, hormones, bile acids, and carnitine for fatty acid breakdown. And it's an antioxidant in the blood and body fluids, and it helps us maintain our immune system. It regenerates active and antioxidant form of vitamin E, and it helps us with iron absorption. So people who are iron deficient, they often say consume high vitamin C foods with iron foods to increase absorption of iron. Here's some functions. You can see no vitamin C. You have weak healing, so it's very much involved in healing. You're not forming new skin, new connective tissue, but with additional vitamin C or adequate or sometimes even supplemental, we can see that we grow strong, healthy connective tissue. So often people that are recovering from surgery or have serious wounds, they'll give supplemental vitamin C. You can see the RDA is not that high, and if anybody takes any of those vitamin C supplements, that can be thousands of times what we need. We get it in most citrus fruits, strawberries, kiwis, cantaloupe, cabbage, dark green vegetables, green and red peppers, okras, tomatoes, potatoes. You've probably heard of scurvy. In Florida, we seem to talk a lot about pirates and scurvy. Gum and tooth problems, joint pain, bleeding, poor wound healing, bone fractures, fatigue, depression, and hysteria. But you can get excessive. Too much vitamin C is too much, and excessive vitamin C supplementation can cause diarrhea, nausea, abdominal cramps, and possible increased kidney stone formation. So you have to be really cautious with some of these vitamin C supplements out there. So here's a picture of scurvy with the gum and tooth problems and bleeding. Vitamin C sources, we can see the highest is orange juice, kiwi, strawberries, cantaloupe, and our citrus fruits and some vegetables. Choline, that's a water-soluble substance included in most vitamin B complex supplements. And it's synthesized to a limited extent by humans, but it is an essential nutrient. It's not currently classified as a vitamin, but it's needed for synthesis of the neurotransmitter acetylcholine and for the structure and function of cell membranes, lipid transport, and homocysteine metabolism. Sources are egg yolks, liver, meat, fish, wheat, germ, and nuts. Deficiencies during pregnancy can interfere with fetal brain development in the fetus and causes fatty liver and muscle in adults. So deficiencies are an issue. Excesses can give us a fishy body odor, sweating, reduced growth rate, low blood pressure, and liver damage at levels higher that can be obtained by food. So water-soluble vitamin summary. We talked about thiamine, riboflavin, niacin, biotin, pantothenic acid, vitamin B6, folate, B12, vitamin C, and choline. So make sure you really take a good look at those. You don't have to memorize them all, but I'm going to ask you something about those on the test. So to be sure that you've reviewed them in the chapter.